Hi everyone again. I want to welcome Dr. Nicole Sparks. She is an OBGYN in Atlanta, Georgia. She works at the North Atlanta Women's Care Practice. And today we're going to be talking about racial disparities in women's health. So welcome, Dr. Sparks, and thanks for being here.
Thank you so much for having me.
Anytime. We're excited about our discussion today. So before we get into the topic, can you tell us a little bit about what brought you into OB and sort of your path here?
Sure. So I've always wanted to know that I wanted to be a physician since about the time I was about 4.5. Did not know I was ever going to be an OB/GYN. And during my third year of rotations, I did general surgery and absolutely loved operating, but wanted more of continuity with my patients. And then when I did OB, I realized that I just got the best of both worlds. I was able to operate, I got to deliver babies, and I really got to connect with women on a personal level. I tell people that I know a lot about these women that they don't tell their spouses or their best friends. They really trust us, and realized I could help women across generations. My mentor would see their parents and see their daughters and so on and so forth. And that just really stood out to me. I didn't want to go into it because of the call, but everything else kind of superseded that. Also, I just love women's health. I love telling women how to advocate for their bodies and advocate for their health. So I just feel like OBGYN is really a perfect fit for me.
Yeah, it's an interesting lead in that you mentioned advocacy. It's a great lead in for our topic because advocacy is so important when it comes to healthcare disparities. And so I think, what would be really interesting is if maybe we just went sort of from the beginning of your young years when you're experiencing your period and, we can talk about some teen pregnancy rates and then sort of get into the older, as we get a little bit older and talk about some of the disparities that exist in becoming a mom and maternal health. So can we just start off about talking about periods and some access to healthcare issues that might be experienced by different populations?
Sure. So, starting when we're younger, we have found that there's just a stigma around talking about periods. And that is more apparent in certain populations, especially within the Black population. And people don't realize that that can actually lead to more disparities. And so, I feel like as a whole, we see periods as dirty or unclean or things like that. And it's really just a natural biological process that happens, and we should treat it as such, because there are young women who 11, 12, and 13 who have their periods and they have no idea what's happening to them. They have shame, they're missing school, they don't know what questions to ask. And so I think as a whole, it starts just at home with making this just a normal conversation topic before it actually happens, from when children are younger, and not just with women but with men too. Like it should just be an entire conversation. And then the other thing is on the providers. So, according to ACOG, which is our college for OBGYN, they actually recommend that young women start seeing us between the ages of 13 and 15 years old. And of course, we're not doing a physical exam or anything like that, but really when young women come to see me at that age, we're talking. I want to know how your periods are, because especially in the Black community, they'll say like, oh, your periods are supposed to be heavy, or they're supposed to be this. And that's not actually the case. That could be masking a more serious condition like fibroids or endometriosis. And we're just saying, oh, your periods are just heavy. And we're not actually looking into what the root cause is. And so when women come to me, especially at that age, we talk about what is a normal period? How long should it last? How heavy should it be? What is the proper terminology that you were using for your body parts and all of this? And, what is a healthy relationship? You'd be surprised, middle school is when young women and young men first develop some of their serious relationships. And some of them are in not great relationships even at that age. And so I like to kind of tease that out and talk to them about what should and shouldn't be said in a relationship, how your significant other should make you feel, and things like that. And so I feel it's very important that if a woman learns to advocate for herself, even at the age of 12 and 13, that's just going to carry over to when she gets older.
Yeah, that's really interesting that you mentioned the age of 13 to start seeing an OBGYN, because I definitely think that a lot of women maybe don't know that, right? Because they're already seeing maybe a family practice or a general care provider. And, a lot of credit to them as well. They kind of have to handle a lot of different things. And so maybe they can't get into some of those very specific period related issues and even relationship related issues. And again, great point that you mentioned that women don't need to be sort of scared to come, because you think OB and you're like, oh my God, I'm going to get like a
people think of like a scary speculum, and I try to tell them that I'm like, we don't ever have to even do a speculum exam unless you're, number one, having issues. You know, we do have some young people who are having issues and discharge and they want me to look at, but I was like, I don't even have to do that until you're 21. That's when we do the first pap smears. So you can literally just come and talk to me. Like I tell them, write down all your questions before your first visit and allow me to answer them for you from an evidence-based perspective. People are going to Google things anyway. I'd rather them come to us and get information that's actually evidence-based than whatever they're going to find on Google MD. So I just, I'd rather that.
Yeah, it's one of the biggest goals of this entire FemHealth initiative is that connecting people like yourself who have the evidence-based, knowledge and the credentials to back it up, and putting you guys in front of a population that really needs that information. So they're not getting the wrong information. So hopefully we are reducing healthcare disparities by a conversation like this for someone who can't get in front of a provider right away for one reason or another. So, I mean, again, let's talk about access. So talk to me about access in different communities, and in Black communities specifically for women's health.
Right. So access is definitely less. We know that. And it's not just access to care, it's access to quality care. And I tell people this goes back to redlining, where certain populations, don't get as much money for bank loans, their school systems aren't as great. It's the same thing with the healthcare systems. In certain populations, they do not have access to quality care. And that in turn will lead to delayed diagnosis, misdiagnosis, and then just contribute to the disparities that we see with African Americans, where they have higher rates of, cardiovascular disease, diabetes, all of these things. And it really, a lot of it is the access. If they don't have a mode of transportation, if there is no money, if you have to choose between going to the doctor and eating, you're obviously going to choose to eat. And so that's definitely an issue. And, I know we said we're going to touch on pregnancy rates. And of course, with Latinx and Black women, it's much, much higher. And again, for a lot of the same reasons. And again, I feel like this is where providers can step in, because something that we do see is with my younger patients, their parents will come in and they just like, no birth control. That's going to make them, have sex and all that. Not really the case. A lot of time we use it for acne. Dermatologists will send me their patients so we can get their acne cleared up, or because their periods are heavy. But honestly, kids are going to do what they want to do anyway. So you want them to do it safely. And so again, I'll talk with the patient and their parent for a little bit, and then I'll kindly kick the parent out and I'll talk to them on a one-on-one level. And even with televisits, we can do this. You don't even have to come into my office. We can do televisits, and I can tell you all of your different options, so you don't have an unwanted pregnancy. I'm not going to be unrealistic and say, none of you have sex until you're married. That's not going to happen, So let's talk about what we can do so that you don't have an unwanted pregnancy at 16 or 17. And again, that goes back to access. That goes back to providers actually asking the right questions, and actually goes to providers just simply caring. I know we're in a system where it's like get people in and out. We have to see a certain amount of patients every day. But when it comes down to it, you really just have to listen. And even when I worked with medical students, I would tell them, there are certain things you'll get with a history and physical exam before you have to order any lab or any imaging. The patient will almost always tell you what is wrong with them if you listen enough. But sometimes I feel we're so quick to just rush them out of the room and, get labs and get this. And usually the patient will say something key, and I'm like, this is probably what's going on, and so I just feel like as providers, we have to take initiative too, so that our patients feel comfortable with these things, because that'll definitely contribute to reducing some of these disparities.
Yeah, and we know that teen pregnancy rates, if they're high, they lead to other problems down the line, reduced rates of women finishing school, having a career, and that just could lead to more healthcare disparities. If they don't have a career, they don't have health insurance, maybe because a lot of us get health insurance from our employer. So, all these different sort of ripple effects down the line that start to happen really at a young age, when women don't even realize that they're sort of part of the healthcare disparity, right? Like they don't even realize that they're in a disadvantage, and they need someone like you or their doctor to tell them, like, you need to be more aware of this, and you need to be, an advocate for yourself. So let's talk about the next, phase of life when we start to talk about, women that want to become pregnant, become moms. What are the disparities that exist with maternal health, among the racial disparities that exist?
So unfortunately, the racial disparities are pretty significant, especially in the US. As a developed nation, you would expect us to have less, healthcare disparities as it pertains to pregnancy, but that's honestly not the case. And pregnancy is such just a wonderful time. And, most of our patients are otherwise pretty healthy. They're young and they're healthy. So you don't really expect that you should die in pregnancy. And you certainly don't expect that it should be happening in the United States, but we have actually the highest rate of pregnancy mortality of developed nations. I mean, it's really, really bad. And even when they do studies, they did a set of studies in 2007 and 2008, and then repeated them 2015, 2016, and the disparities are actually no better. They're no better, on the CDC website. And so you have to ask yourself why that is and what factors are contributing to that. And so a lot of people already know the stats, especially since all of this has been happening. They've been thrown out. Like, we know that Black women are 3 to 4 times more likely to die, from a pregnancy-related death. And I tell people pregnancy-related death, meaning either the mom dies during pregnancy, during childbirth, or within a year of childbirth, and we can attribute it to something that was as a result of the pregnancy. So anything that's within that time frame, that's what counts as a pregnancy-related death. And they have done many studies, and they say, some people will say, well, it's because they're poor, they have worse diabetes, or they have worse high blood pressure, or things like that. And some of that is actually true, but people have to realize that even when they control for a lot of these things, okay, a Black woman who has graduated from college is still going to have worse outcomes than a white woman who has not even graduated from high school. And so you have to ask yourself, well, why that is. And we don't have direct answers. We know that some of the main contributors of death include cardiomyopathy, preeclampsia. If you don't know what preeclampsia is, it's basically high blood pressure in pregnancy, which can, end up having some end organ related damage. Hemorrhage is a big thing. And there's some stories about that. A young woman named Kara Johnson, who's only 39, and a lot of people should know this because her husband is a big advocate, but she came in for a standard repeat C-section, and, said she didn't feel well, and her husband tried to get a hold of somebody, and it took about 10 hours for them to finally evaluate her. When they took her back, she had liters of blood in her abdomen and died, and she's healthy, active, and that really shouldn't happen. And so again, you have to ask yourself, why is this happening? And we realize at every level, there's something that needs to be done, at the hospital level, at the administrator level, at the provider level, and at the patient level. Right. And so the disparities are really, really terrible. They're really, really bad, especially in the US, and they're not actually getting better.
And that's so scary. And what you mentioned, all these different levels. So tell us how we can start to make a change. There's thousands of women watching this right now, literally. So how do we start, patient level, provider level? Like, what can we start to do so we can see some movement of the needle in the right direction?
Of course. So I would say that at the patient level, and, like I said, I love just telling women how to advocate for themselves because I believe that's a key. I also don't think it should be all on the patient. That's not fair. I feel like everybody else needs to take responsibility, but I do feel as patients, there are definitely some things you can do. And I've talked about this before, but I say the number one thing is, choose your doctor wisely, because your life and your baby's life may very well depend on it. So you want to make sure, whether it's just a friend saying, oh, this doctor was really great, or you're reading reviews, but actually choose your doctor wisely. Make sure that you take the time. Don't just choose anyone off the street. Choose a doctor wisely. We're with you for 10 months and delivering your babies. You want to make sure that you trust whoever is taking care of you. The other thing is that make sure your provider listens to you. So what is your gut feeling when you go to that first visit? Do you feel like they're listening to you? Are they judging you? Are they rushing you out of the room? I know that we don't have unlimited time. I cannot spend 40 minutes with every patient. Sometimes I do because it's necessary, but then remember that puts us back, and other patients will get mad if they have to wait. So I want people to realize that, like, we can't do that. Realistically, we can't do that if we want to be able to see the patients. But know that your provider should take the time to listen to your concerns. And if you have any red flags that come up, or if you feel like your provider is not listening to you, there is no contract with them. You do not have to stay with that provider. You can find a new provider, The other thing I tell women is to make sure that you ask questions, because one of the things I say in every single visit is, do you have any questions? And when they say no, I say, if you think of anything in the meantime before your next visit, I want you to jot it down on your phone. So when you come to me, you can rattle them off, and I can make sure that you answer your questions. Because if women aren't well informed, if they don't know, for example, the warning signs, if you don't know that you should be looking for headache, or this blood pressure range, or these warning signs, and you don't know that it's wrong. And so I feel like we need to actually educate and empower our women, and you have to educate and empower yourself so that you ask your doctor, what should I be looking for? And patients ask me that, what should I be looking for? What are the signs of preeclampsia? How much bleeding is too much bleeding? Ask your provider that so that you can call and say, you told me this, I am having this, what should I do next?
Right.
Okay. And then the other thing I would say is that if your provider isn't listening to you, then please find one that there are plenty of, I know there are some doctors that are not so great, but there are plenty that are wonderful, and there are plenty that will take great care of you during your pregnancy.
Yeah.
And then just on the provider level, we have to listen, and we have to empower our patients. So I will tell my patients, this is what you need to look for. This is what is a warning sign. This blood pressure is okay. If you're taking your blood pressure at home, if it's 160 over 110, that's an emergency. I need you to call me. You need a workup. But we actually have to empower our patients with these tools so they understand. The other thing is making sure you have a good support person. So it's making it very hard with COVID, of course, because I usually tell patients, if you want a doula or things like that, then get them, because sometimes they are more well aware. Here's my son. So they are more well aware of some of the things that are going on and can help the patient actually ask the right questions. And so if we have to do a stat C-section, sometimes the mom will be like, what's going on? And it helps to have a support person there who can say, well, the baby's heart rate is doing this and everything. And, in a fast-paced situation that, you can actually get your questions answered and be well informed about what's going on.
No,
as far as the systemic level, so on the CDC website, there's a bunch of things that are going on higher levels. Like there are a bunch of maternal mortality review committees who are actually trying to implement just standard protocols so that if women come in with certain, warning signs, that certain things are actually implemented. And they're actually reviewing any woman that dies within a year of pregnancy. They will review and say, was it because of a pregnancy related cause? Was it because of something else? And what can we do? So there are things that are in the works, but obviously more needs to be done, because if all of this has been in the works, then why are the statistics still the same?
Right. No, of course, especially with young women. And you hit on something really interesting, which I'd love to comment on, which is, you're not tied to your provider. And it's very interesting because I actually, in my 35th week of pregnancy, changed providers.
Wow.
And my provider up to 35 weeks was completely competent. I had no doubts towards their competency, towards their knowledge base, but it was about comfort. And I just didn't feel comfortable. It was something in my gut that told me, like, I just, everything's going fine right now, but God forbid something goes wrong, as it can. It's a high risk field. Things can happen, and I know that as a physician. So it's like, I just want to feel confident that I did what felt right to me. And so, like, I know that's crazy, 35 weeks, right? Like, and I ended up delivering at 37 and a half. So I was only with my new provider for 2.5 weeks. But I felt good about it. And I felt like, I don't know, I just felt like I really trusted them. And there's just something, and not everyone's a right fit. So you can have like doctors that like are more relaxed and they're maybe a better personality for certain patients. And then you have doctors that are more rigid and more like throwing facts at you left and right. And they're right for maybe another type of patient, right? So it's like, it's completely okay to change providers. And it's funny because I see the same thing to my patients too. Like when I start to feel like they're not feeling confidence in me, I'm like, please get a second opinion. Like, I have no problem with you getting.
I'm going to add, I tell my patients that too. And if they're kind of looking like, oh, I don't know if I believe you. And I'm like, it's okay. And I don't get offended. I feel like some physicians get offended if their patient wants a second opinion. I'm like, get it. I want you to get it. I want you to understand all your options, and then you can come back and we can talk. And there is absolutely nothing wrong with that. There's nothing wrong with switching your providers. Like you're saying, you are a physician, you did it at 35 weeks, and not because your provider was incompetent, but because it wasn't a good fit. Yeah. And there are some providers, like there are some patients that come in and we click right away. And, there's one patient I said, I was like, you will be my patient for life. I was like, I can just tell. And she was like, absolutely. You just have that connection. And if you don't have that connection, guess what? It's okay to leave, And I'm not saying I connect with everybody, because I don't, but there are definitely some patients where we talk and I know that they trust me. And to me, that's the biggest thing, because if you trust me, people have to realize that because of things that have been done, you know, if you think of the Tuskegee experiment and Henrietta Lacks, and, you know, so many Blacks do not trust the healthcare system. They don't. And so if they don't reveal what's going on, you can't help them. So I tell my patients, if you don't tell me everything, you are actually impeding me from helping you. But people have to realize you don't just gain that trust. You have to earn it. You have to earn it because there are years and years and years of things that have happened to us as a people. And, you know, in some people's minds, they're like, well, they don't have my best interest in mind, because that was true. That wasn't always the case. So you really have to try to earn your patient's trust. Let them know that you are trustworthy. Let them know that you share the same values, and let them know that you are there to help them.
Right. Yeah. Communication, so important.
Communication. Yep.
So important. Well, this was an amazing discussion. I learned a lot. I know everyone watching learned a lot. So thank you so much. And for people that want to learn more, I know you're very active on social media and you also have a blog. So can you share where people can find you and follow you?
Yes, of course. So yes, I'm mostly active on Instagram and my blog at Nicole Alicia MD, and it's the same across all sites. My website is www.nicolealiciamd.com. Twitter is Nicole Alicia MD, TikTok Nicole Alicia MD, just Nicole Alicia MD everywhere. So if you want to find me, I talk a lot about this on my blog, really focus on motherhood, but I definitely, now with everything going on, I have made it a point to talk about how women can advocate for their health, because I really, you know, we as a whole just really want to see that, you know, this goes down. And, you know, I have 2 children. I have a 1 and a 4-year-old, and it's very unexpected. You never know. Their wonderful father's supposed to be watching them, but, you know, he snuck in here, and that's fine. But yes, you can find me on any of those sites. I love talking about this. I love women's health. Always advocate for yourself. No one should be dying in pregnancy. It just really shouldn't happen. And remember, even if you're a teenager, you can still go see your doctor. We don't have to use our scary speculums. We can simply just talk to you about any questions that you have.
Exactly. And this is like the perfect clip for your blog about motherhood and being like a badass doctor. Like, you're like talking to us about racial disparities. It's like super serious topic, and your son's running around.
It's fine. It's what happens.
Love it. Well, thanks again. And I look forward to hearing more from you.
Of course. Thank you so much for having me.